The first step in the medial canthoplasty is catheterizing the nasolacrimal ducts to ensure that we protect them and don't inadvertently close them down during surgery. Next, we remove the edges of the eyelids at the inside corner of the eye, just a few millimeters, and then sew it all back together in order to reconstruct a new eyelid margin. We're now going to do the same thing on the left eye. As I'm catheterizing the nasolacrimal ducts here, the bottom duct is actually occluded and plugged up. So you could see there we were flushing in some flush to improve the patency and open it up so we could catheterize it. And now we're doing the same thing on the other eye, removing those lid margins and then sewing everything back together. And now we're going to switch to the Nares procedure where we're going to open up the nose. They're prepping the nose with some betadine and sterile Q-tips. So now I'm going to put some stay sutures in the nostrils to hold the piece open that I want to cut. I'm cutting a little wedge out of the nose, and then I'm going to sew the two pieces together on either side of the wedge to kind of open everything up. Now I repeat on the other side. You can see those sterile Q-tips are sticking in there to control some bleeding. And then now I'm going to go back to the other side and just try to make it look more like the second side because I want them to look as similar as possible.
All right, so we just finished, and you can see he has much bigger nostrils now. So he's going to be able to breathe much better. And then, most importantly, it's going to keep that pressure from building up in the back of his throat, which is going to keep his palate and laryngeal saccules from becoming a problem long term. And then we ended up doing a medial canthoplasty, which means we did the surgery on the inside corner of his eyes. You can see his eyes still look normal. They just don't open up all the way right there in the corner. And that's going to allow his eyes to stay closed while he's asleep, which this is a perfect example of. Before surgery, his eyes would have been cracked open a little bit because they're pushing forward so far. So he's going to do very well. The nice part about being able to do it on this medial side is that it also protects the eye from this fold right here. This fold is really common in most of these guys, and the hairs on this will rub on the eyes right there and cause chronic irritation. So by closing this down on the inside, we're going to protect it from the fold too. So he's going to have to wear an e-collar, the cone of shame, for 2 weeks, and then after that, he should be perfect.